It is indeed a privilege to meet you, even if virtually. And while the pandemic has impacted many aspects of our life, it has not dampened our excitement for engaging and introducing you to the University of Maryland over the next hour. I'm Rodney Taylor, and I'm chair of the Department of Otolaryngology. We always get excited as residency season approaches. It gives us a chance to meet many of the brightest students from around the country, with the knowledge that 3 of you will become a part of our family. In parallel to providing the highest quality patient care, the education and training of our residents is our #1 priority. We recognize that the years of residency will require hard work, yet also will be a time of personal growth and development. Here at the University of Maryland, we have been very intentional about creating an environment where this is achieved in a constructive and enjoyable way. We are excited about the opportunity to support and mentor you through these wonderful years along your journey. At the University of Maryland, we foster a family orientation and have created a community of excellence that we believe will be an extremely rewarding place for you to train and realize your goals. In terms of our mission, it is more than a statement on a website. Rather, it is the very reason that we exist. We are a diverse community of physicians and scholars. We exist to provide to every patient that we are privileged to meet the highest quality, compassionate care that is recognized nationally for its excellence. We dedicate ourselves to discovery that will contribute to new solutions for diseases of the ear, nose, and throat. We will remain steadfast in our resolve to train the next generations of physicians who will be of the finest character, exceptional thinkers, and extraordinary technical experts. Our department strongly endorses a climate where every patient, physician, and employee feels welcome and valued, no matter ethnicity, gender identity, sexual orientation, socioeconomic status, faith, disability, or any other uniqueness. We believe that our differences allow the illuminating perspectives that promote broader understanding and a safer, more productive, healthy environment. My hope is that over the next hour, you will gain some insight as to who we are, what our values are, strengths, and why we believe that this will be a wonderful opportunity for you to grow and develop into an outstanding otolaryngologist over the next 5 years. Before we dive into detail regarding our department, I want to speak more generally to our setting and environment. I joined the department nearly 20 years ago, and we have enjoyed watching the growth of our city and region over that period of time. Baltimore is a city that supports wonderful culture, outdoor activity, great sports teams, and world-class educational opportunities and resources. No matter what your hobby or interest, Baltimore and surrounding region is a playground for you to enjoy your time outside of work. Similarly, the University of Maryland School of Medicine, Medical Center, and Medical System have enjoyed transformative growth and success over the past 2 decades. The University of Maryland School of Medicine is the first public school and medical school in the United States and the first medical school to establish a residency program. Its tradition and present identity is built upon education and training as its top priority. The School of Medicine is home to more than 43 academic departments, institutes, and centers of excellence that support world-class clinical programs and research. It's renowned internationally for its Institute of Virology, Institute of Genome Sciences, program in personalized genomic medicine, and home to the nation's top scientists and thought leaders. In terms of clinical programs of excellence, there are many, but nationwide, the R.A. Cowley Shock Trauma Center and the University of Maryland Greenebaum Comprehensive Cancer Centers are among the nation's very best. There are numerous other phenomenal clinical and research programs on campus that make education, innovation, and collaboration part of our everyday culture related to the advancement of patient care. At a medical school and on a campus where there is such breadth of quality programs, I'm very proud that the Department of Otolaryngology is recognized as a flagship program at our medical school and garners the respect and support of the leaders at our institution. From a patient care standpoint, the University of Maryland is seated in the heart of a bustling urban community and is a busy, vibrant academic medical center that serves our immediate neighbors, the state of Maryland, the Mid-Atlantic region, and in some instances, our nation and world. I can assure you that those who complete their training here at the University of Maryland finish comprehensively trained in every aspect of our subspecialty, confident, competent, and poised to realize all their dreams in otolaryngology. From an educational standpoint, you will learn in detail about our structured mentorship program that is aligned with rigorous didactic training that will ensure that you are ready for the full complexity of our specialty. We are proud that 100% of our trainees match into fellowships area of their choosing, and 100% also pass the board examinations. And also during your training, you will also have access to world-class investigators both within our department and outside. You will learn and add to your knowledge of research fundamentals and will certainly be mentored to make scholarly contributions during your residency. I truly hope that you enjoy your virtual tour with us today.
Hi, I'm Elizabeth Guardiani, and I am the Residency Program Director for the Otolaryngology Residency Program at the University of Maryland. We are really proud of our residents and our program, and I hope by the end of this presentation that you'll see why. We are a fully ACGME accredited 5-year residency program consisting of 3 residents a year. Our residents have the opportunity to have dedicated rotations in all of the subspecialties of otolaryngology, as well as have the opportunity to work with physicians in other departments such as dermatologic surgery. We are an extremely high-volume clinical center, and as we have no fellows, our primary focus of teaching is on the residents. Because of this, our residents graduate with an average of over 2,000 cases at the end of their residency. Our residents have the opportunity to practice across a variety of different settings, including outpatient faculty clinics, our dedicated Medi-Spa, the R. Adams Cali Shock Trauma Center, which is a dedicated Level 1 trauma center attached to our main hospital, as well as the Baltimore VA Medical Center, which offers a unique opportunity to care for veterans. In addition to the clinical training, our residents also have a dedicated research block, as well as the opportunity for mentored research throughout their residency. We have a 2-year didactic curriculum, which is both faculty and resident-led. Every week, residents have 1 hour of faculty-led didactics and 1 hour of resident-led didactics that follows a block curriculum so that the residents are exposed to the material at least twice between their PGY2 and PGY5 years. In addition to this, the residents have the opportunity to participate in a multitude of different multidisciplinary conferences such as Head and Neck Tumor Board and Multidisciplinary Airway Conference. Our former residents have gone on to take a variety of different paths, including matching into extremely competitive fellowships, academic careers, and successful careers as private practice otolaryngologists. Our goal is to prepare you for the path that you feel is best, and we are proud of all of our former residents and current residents. We thank you again for taking the time to visit our program today and to learn more about us, and if you have any questions, I'm happy to answer them. Please feel free to reach out to me anytime. Thanks.
Hi, my name is Dr. Hertzano. I'm a surgeon scientist in the Department of Otolaryngology Head and Neck Surgery here at the University of Maryland School of Medicine. A pillar of our department is research and discovery, and for this we have 4 laboratories that do cutting-edge translational research. 3 of the labs study the molecular basis of auditory and vestibular dysfunction, and 1 lab, the lab of Michal Zalzman, studies stem cell research. My laboratory specifically is a laboratory of functional genetics and functional genomics. We are situated within the Institute of Genome Sciences, where we develop and apply new methods to study the genetics and genomics of the sensory cells of the ear. Specifically, we have 3 lines of research. In the first line, we try to understand the specific transcriptional cascades and signaling pathways that govern the development of the hair cells and other cell types in the ear. In the second line of research, we do similar work, but we apply it to acquired hearing loss. We try to understand what signaling pathways are activated as a result of noise exposure, for example, or aging, so that we can develop new therapeutics to counter them. As part of this line of research, we identified tremendous differences in the hearing between males and females, and we're now using that to develop new treatments for hearing loss. Finally, we study and develop new methods for data sharing, particularly multi-omic data sharing between labs, and developed a site called the GEAR, the Gene Expression Analysis Resource, that allows people to share and analyze multi-omic data. We welcome residents, medical students, undergraduate and graduate students in our laboratories, and we think it's very important to allow everybody, regardless of their background, an opportunity to engage in translational and basic science research.
My name is Zubair Ahmed. I'm professor in the department. My team here on the 7th floor is part of the Auto Translational Hub, and specifically we focus on the development of sensory system in the retina and in the inner ear, with the idea of finding therapeutic options for patients suffering with these disorders of these two systems. So my lab starts with the genetic analysis of patients coming to our clinics, and we use their genomic DNA for comprehensive genetic profiling, including their exome sequencing, their genome sequencing, to identify the underlying genetic cause. Once we identify the gene, then we build animal model and cellular model system. Animal model including fish and mice. We use these models for understanding the disease pathology as well as for therapeutic intervention like virus-based gene delivery, CRISPR-based genome editing, or small molecules like read-through compounds, and see if we can come up for a therapeutic strategy that can be translated back to our patients. Also on this floor, there are two other labs. One is by Professor Saima Riazuddin, and her lab uses similar approaches, but her focus is mainly on the non-syndromic forms of hearing disorder as well as intellectual disabilities. Her lab leads the clinical genetic testing program in our department, and together with other otolaryngology faculty members, especially the clinicians, she is building a comprehensive center of excellence on auditory research. Finally, the third lab is Professor Rodney Taylor, and that lab focuses on the stem cell-based research in the department.
Thank you for your interest in the University of Maryland Otolaryngology Residency Program. My name is Amal Isaiah, and I direct resident research in the department. While the dedicated research block is in the third year of training, resident research really spans the entire duration of training. The University of Maryland is a research powerhouse and provides many opportunities for basic, translational, and clinical research as well. The dedicated rotation in research has been an integral part of the residency training program at University of Maryland, at least for the last decade. Apart from a structured experience in a chosen project, the 6-month rotation aims to provide time and expert guidance for publications that support further academic pursuits, for example, fellowship training. The PGY2 resident meets the chair of resident research committee 6 months prior to the proposed start date of the project. The initial meeting will identify the broad theme of the project, for example, whether it's basic science or translational or whether it's clinical, and then a list of potential mentors is provided. This list is subject to change each year based on faculty interest, and we have many faculty mentors available on campus who can help direct that project for you. The principal focus for the block is structure. That is, the project should have recognizable goals and milestones. Typically, these include testable hypothesis, the potential for completion within the 6-month time frame, the potential for publications within the year of start of project, and plan for reasonable recruitment for clinical subjects, that is, if the study is clinical in nature. A statistical analysis plan and sample size calculation need pre-specification, and we have plenty of resources that can help with that. Our residents consistently publish more than 4 to 5 manuscripts during the course of their training, and some do even more, especially in the choice of further fellowship training. We do look forward to working with you in furthering your research interests in our program. Thank you.
Our department is at the forefront of both clinical and basic science research. For my own personal interest in machine learning, my research mentors have provided great guidance in achieving this goal. But for all of us, our faculty, both within the department and the School of Medicine as a whole, are very, very enthusiastic about providing guidance and finding opportunities to tailor each individual interest.
Hello, I'm Rodney Taylor, and I've been on the faculty of the University of Maryland now starting in my 20th year. I did my training at the University of Michigan after finishing at Harvard Medical School and became a faculty member here and have loved every bit of it. My clinical focus is head and neck cancer, the comprehensive management of patients with head and neck cancer, skull-base cancer, but I enjoy a practice also that includes rhinology and endocrine surgery and really the full scope of our specialty. My favorite procedures really are in the head and neck, and I love teaching residents the surgical technique and management of neck dissections and parotid surgery and partial laryngeal surgery. I also enjoy thoroughly having a very talented group of colleagues who I have an opportunity to work with from time to time and collaborate during surgical procedures. And it's just really an environment that has been a joy to form a practice because we get along with each other so well. We spend time with each other outside of work, and it's one of the reasons that makes this a fun place to come every day. My research interests align my clinical interests, and they involve really advancing the care of head and neck cancer and understanding, both looking at regenerative purposes of stem cells as well as cancer stem cells. Should you come and join us here, I would love to have an opportunity to train you and have you be a part of the fun family environment that we've created. Thank you.
Hi, I'm Kelly Moyer. I'm one of the newer faculty here at the University of Maryland. I work primarily at our Midtown campus. My specialty is head and neck surgery. I focus primarily on mucosal malignancies like squamous cell carcinoma, salivary disease, and also endocrine pathologies like thyroid and parathyroid surgeries. I enjoy airway management and have some research interest in doing airway management in thyroid disease, especially anaplastic thyroid cancer. I actually was a medical student here at the University of Maryland and was super excited to come back as faculty. I trained in otolaryngology at Georgetown University in Washington, D.C. and completed my head and neck fellowship at Memorial Sloan Kettering in New York City. I can say as a medical student and a faculty member, I think the best thing here about the University of Maryland is the people. We certainly have a very collegial and friendly department, and all the faculty are approachable and easy to work with. We all have an interest in working with medical students and residents, so I think that makes it an excellent advantage in our department. Personally, outside of clinical work, I do have an interest in education, so I welcome the opportunity to speak with any of you, and I'm happy to do so to discuss things further. I wish you all the best of luck and look forward to talking to you soon. Thanks.
My favorite thing about our residency program here at Maryland is the camaraderie. I'm super close with my resident colleagues. We all get to hang out outside of work. We get along really well inside of work. Our attendings are super approachable, and they're truly interested in us as people, as residents, and outside of residency life.
My name is Jeffrey Wolf, and I'm a professor of otorhinolaryngology and the program in oncology at the University of Maryland. I'm a graduate of the University of Pennsylvania School of Medicine and completed my otolaryngology training here at the University of Maryland. Within the department, I am the Associate Chair of Clinical Practice and the Medical Director. My clinical interests consist mostly of head and neck oncology with some rhinology and skull-base surgery. I also do a smattering of sleep apnea surgery, including hypoglossal nerve stimulator implants. My research interest revolves around innovation and medical device design. I have invented a few devices in the realm of airway and sleep apnea, and we are beginning to test some of those in clinical trials. On the service front, Dr. Taylor and I have co-founded a nonprofit called Maryland Ear, Nose, and Throat Abroad, or MENTA. We try and go on one big surgical trip every year and bring residents with us so they can understand the importance of global service. In the past, we have gone to Kenya, Fiji, Vietnam, Uganda, and Cambodia. I hope you've enjoyed this presentation and look forward to meeting you on interview day.
Hi, my name is Kyle Hatton. I'm a head and neck surgeon at the University of Maryland and the director of robotic surgery. One of my clinical interests is working with HPV-associated cancer and the robotic surgeries associated with them. Those clinical interests have really spurred a lot of my research pursuits, and it's been one of the most enjoyable parts of my job is getting to share that interest with a lot of medical students and residents. Cultivating their interest so that they are interested in pursuing head and neck fellowships have been one of the most rewarding parts of my early career. Just so you know, my favorite surgery is really any one I get to see a resident do independently. Regarding myself, I'm interested in running, hiking, and playing tennis, and I have to say I can't wait to train the next group of future otolaryngologists.
Hello, and welcome to the VA.
Hi, doctor.
I'm going to take a look in your ears now. The VA rotation is a great experience for residents as we get a lot of autonomy and have the privilege of taking care of veterans. As you can see, we have great resources to enhance our veterans' care.
Hi, my name is Andrea Hebert. My subspecialty is rhinology, allergy, and anterior skull-base surgery. Some of my favorite surgeries use the technique of minimally invasive surgery with the endoscope to do things that we couldn't do previously. So endoscopic resection of sinonasal malignancies, extensive frontal sinus surgery, things like that. I also like repair of CSF leaks. One of the things I'm most proud of is in the last year, we opened up an allergy program, and we are now looking forward to bringing the residents into that area. We are also doing more in-office procedures, and we have the residents incorporated in that as well. Some of my research interests include research in invasive fungal sinusitis and CSF rhinorrhea.
I'm going to talk a little bit about our call system. Our senior residents are our 4th and 5th year residents, and they take call from home. And our junior residents are our 2nd and 3rd year residents, and we take in-house call with a post-call day the next day. We rarely have to travel from our main campus, and our VA is connected by a bridge, so we don't have to leave the hospital.
My name is Dr. Kevin Pereira, and I'm the Director of Pediatric Otolaryngology for the department. Residents spend close to a year of their training on the pediatric service, at which time they're exposed to a variety of routine, moderate, and extremely complex cases. We are fortunate to have one of the largest and most modern Level 4 neonatal intensive care units in the region, which provides them with a great experience. My personal clinical interests are head and neck infections, neck masses in children, and the neonatal airway. My research is focused on the same entities, and residents are actively involved in it. Our research is presented annually at most national meetings, and we publish several manuscripts each year. 2 of our residents in the last 2 years matched into top-tier pediatric otolaryngology fellowships. I foresee having an additional faculty member join our team in 2022. I love the collegiality, camaraderie, and the informal work environment we have here at the University of Maryland.
My name is Amal Isaiah, and I'm an associate professor in the Department of Otolaryngology, Head and Neck Surgery. I graduated medical school from St. John's Medical College in Bangalore, India, and subsequently completed a PhD in neurophysiology at Oxford University, England. My residency training in otolaryngology was at University of Maryland, and I completed a clinical fellowship in pediatric otolaryngology at University of Texas Southwestern Medical Center in Dallas, Texas, before being recruited back here as a pediatric otolaryngologist in 2016. My clinical interests include the entire breadth of pediatric ear, nose, and throat pathology. We have a large cardiac surgery program, and I'm closely involved with airway management in that population. I also perform a large number of tracheostomies in high-risk infants with ASA class greater than 3 and engage in multidisciplinary care of these infants over time, along with colleagues in pulmonary and GI, including airway reconstruction of these kids. My principal research concerns neurobehavioral outcomes in children with upper airway obstruction. My expertise includes statistical modeling and machine learning, especially in large heterogeneous data sets. I supervise projects at a pre- and postdoctoral level, especially with my involvement in the adolescent brain and cognitive development study. Having trained here as a resident, I can attest to a superb educational environment that is collegial and friendly.
One of the perks of our program is the opportunity to participate in many different educational activities outside of our normally scheduled didactics and clinical activities here at the University of Maryland. These include funding to attend many of the national meetings around the country, in addition to multiple courses, including a temporal bone course locally in Baltimore, in addition to nationally at the University of Michigan. In addition, if there are any other courses that a resident's interested in participating in, our department is more than willing to help fund that and facilitate it to maximize our clinical education.
Hi, I'm David Eisenman, the Director of the Division of Otology and Neuro-Otology. I'm very proud of our division. We give broad training to the residents at all levels. You have experience with outpatient and OR as a junior, as a senior, in a very graduated fashion so that when you leave our program, you will be prepared to practice otology either as a part of your practice or as an independent practice. We've had many residents who have gone on to postgraduate training in otology and neuro-otology, but we are equally proud of our residents who have gone on to general practice and have integrated otology as a part of their general practice, including residents who are doing cochlear implantation and many other advanced otologic procedures as a part of their general practice. So whatever you choose to do, we want to teach you otology and neuro-otology, and we've set up the program in such ways you can gain that experience. Look forward to training you if you choose to join us.
Hi, my name is Rona Hertzano, and I'm a surgeon scientist otologist in the Department of Otolaryngology Head and Neck Surgery here at the University of Maryland. My practice is focused on treating patients with diseases of the ear with a focus on hearing restoration. I did my residency training as well as fellowship here at the University of Maryland, where we pride in training residents to do whatever they want, whether that is private practice, research, or academics. We look forward to seeing you here.
Hi, my name is Katie Kennedy, and I'm one of the PGY3s here at University of Maryland. We're lucky to have the opportunity to work at the Shock Trauma Center, which was founded by R. Adams Cowley back in 1960s. Here we take care of some of the most critically ill patients and get an opportunity to see patients in the trauma resuscitation unit, the TRU, and do a lot of bedside procedures.
Hi, I'm Kalpesh Vakaria, and I'm the Director of Facial Plastic and Reconstructive Surgery here in the Department of Otolaryngology. I'm also the Director of the Facial Nerve Center. Here you will have an experience in facial plastics throughout your residency training. You're involved in the breadth of facial plastics, from reconstructive, such as after trauma, Mohs, facial paralysis, and microvascular reconstruction, to cosmetic procedures, such as laser, Botox, and filler, to name a few. You'll receive a graduated hands-on experience while you're on rotation. I'm also the Medical Student Clerkship Director, and I'm very involved in medical student and resident education. Given my background in computer science, my research involves primarily trying to determine how computer technology can be utilized in the care of facial plastic surgery to optimize our patients' care. What I love about the University of Maryland and our department are the people and the positive environment that we work in. I love coming to work every day because I have the privilege of taking care of patients with complex problems, working with residents, faculty, and staff, who I really consider to be my friends in addition to my colleagues.
Hi, my name is Kevin Shigani. I'm one of the current chiefs here at the University of Maryland. And my experience here has been one that I wouldn't change for anything. I've received amazing clinical and surgical experience. And my co-residence position is unique in that we were the first class of 3 residents that was increased from 2, and we've been able to watch our residency grow for the better, both clinically and personally. One of my favorite things is the relationships we've developed with both our co-residents, but in addition to our attendings, who I feel comfortable calling my friends as well. Another plus to our program is the fact that we do very advanced fellow level cases without any fellows, so as a senior resident you're getting that first-hand experience.
Hi, this is Elizabeth Guardiani. In addition to my role as program director, I'm also a laryngologist practicing both at the University Medical Center and the Baltimore VA Medical Center. I treat a wide variety of disorders of voice, swallowing, and airway. I also treat a wide variety of conditions in the office, including with botulinum toxin injections as well as transnasal laser procedures. Residents have the opportunity to work with me across a variety of different settings, both in the office and in the operating room. My goal is for all residents that graduate this program to have a comprehensive understanding of the diagnosis and treatment of voice, swallowing, and airway disorders so that they can carry that into their future careers. My favorite thing about this department is definitely the collegiality and the ability to rely on my colleagues whenever there's a challenging situation on which I need advice. My favorite thing about practicing here at Maryland in general is the complexity of the patients that we treat. We never lack for challenging or complex cases, and it makes me feel like I am truly helping the people that need it the most. Thanks again for visiting today, and we look forward to meeting you soon.
I'm Taylor. I'm one of the 5th-year residents here at University of Maryland, I'm from Connecticut, but I went to medical school here, and so I had a special perspective on the program here, and I felt very lucky to have matched here because the collegial and collaborative environment is a place that I felt was very comfortable and was a place, the type of place that I felt like I could learn a lot and feel productive in during my residency.
What I love about residency at University of Maryland is the people. I love working with my co-residents, the attendings, the nurses, the MAs, surgical schedulers, and nurse practitioners, just to name a few. They're what makes this residency really special, and I always feel very supported to take great care of my patients.
Part of our program is the emphasis that we place on our relationships both with each other and also with our attendings. There's a bunch of people here that I never would have otherwise met, and now we've become really great friends. We're going to each other's bachelorette parties, we're going to each other's weddings. We're actually really good friends with each other, and it's the type of friendship that I expect to last forever. And that holds true also with our attendings, that we talk about things not related to work, and we actually spend time with each other. Like we have the annual wine event where we go to a winery and spend the day together. So that extra step that we take with each other helps us to feel comfortable with each other and makes it a really easy environment to succeed.
Baltimore is an awesome city. There's so many things to do and see here. My favorite thing about Baltimore is it's full of little neighborhoods that are different niches of different things to do.
One of the things I really love about Baltimore would be the places for residents to live. There are so many great neighborhoods within the city that have places available to rent or buy that are affordable for residents. There are also places outside the city in the suburbs that you can rent or buy.
I love the food here in Baltimore too. There's a lot of great variety in the city and in the suburbs, so there's always something interesting to go out and have a bite to eat.
One of the most exciting things about Baltimore is that the people here love sports. The Ravens and the Orioles with tailgates are very exciting.
There's things like Little Italy, which have all these amazing restaurants, but they also have these awesome festivals a couple times a year with live music and people dancing. There's Federal Hill, which has a different type of vibe and different kind of shops. And there's Fells Point, which is great to walk around, eat ice cream on the street, go in different boutiques and shops, They also have live music and lots of different markets throughout the year. There's the Harbor East, which has a different type of vibe, good restaurants, awesome views of the water. It's really cool to be able to rent a boat or just kayak or whatever you want to do on the water in Baltimore or in our surrounding neighborhoods. There's the Eastern Shore, which is also a great kind of vacation day to take and just hang out on a beach. Again, they have little shops and different places to walk around at. Whatever you do here, you'll never be bored. There's always something fun to do outside of work. There's always something new to discover.